Hi, I'm Marnie Harris. I'm the ED Nurse Manager at AdventHealth Fish Memorial. So back when COVID hit, we were trying to come up with different ways to help reduce the workload intensity of our nurses, and virtual nursing kind of came up as a topic. And Banyan was an organization that we had heard about. So far, it's been great. We've had it for a few months now. We went live at the end of April, and the interaction between our team and the Banyan team has been great. The communication is great. I really have nothing, negative to say about it. Leadership is great to work with. The main thing that we've really used it for to kind of start when we first started looking at virtual nursing, we kind of divided it up into different phases on what can we do first and then kind of take it into the future. So the first thing we really concentrated on was having a virtual nurse help the ED bedside nurse with doing a med rec. So any patient that comes into the ED, we need to complete what their home meds are. So that's really where we have optimized this. So the virtual nurse will come on, enter into a patient's room on the TV, and they will now help complete that task for the bedside nurse. Some of those can be very time consuming for a nurse if they've come especially from like a nursing home or an assisted living facility. And sometimes it could take 20 to 30 minutes. So that's really right now the main thing that we're utilizing them for, is to complete those med recs and then also gather their history. So medical, surgical, social histories, which has been able to give the bedside nurse more time to spend with patients and family members. Positive. You tell any ER nurse you don't have to do a med rec, and that's an instant win. So it's really positive. At the very beginning, people were a little hesitant to try to figure out how does that work in an ER setting. But once we actually started using it, we have nothing but positive things to say. Within our EMR, we're able to send chats to the virtual nurse, so the communication is very timely, and the nurses love it. Patient feedback has been positive. At first, they're kind of like, okay, this is a little weird, but once we explain it to them and they actually interact with the nurse, it's all been positive. I think there's two parts to it. I think from the bedside nurse standpoint, it's being able to at least decrease a little bit of their workload intensity. It gives them a little bit more time to do other things, and they don't feel as overwhelmed. From a leadership standpoint, it's seeing that in the nurses, knowing that we were able to do something for them, especially during a pandemic where people are leaving and people are a little bit more stressed out than normal just because of everything that's going on, not just what's happening at work. So from a leadership standpoint, knowing that we made a difference in their days every day.